Hi, it's Karen and Helen here from Nurturing Nurses. We just wanted to have a chat with you today about the healthy hearing screening test that your baby will be offered. This test is usually done around about day 3. We try and not do it any sooner than this because we do require baby to be very settled. And if babies are breastfeeding, usually on day 2, they're cluster feeding a lot whilst mum's milk is coming in. So they're not usually settled enough to receive this test. But on day 3, once mum's milk is in, babies are a lot more settled and then we can carry out this test. Before we carry out this test, we do explain what the screening involves, and we do ask for family history of any ear impairment or anything like that. And then once you sign the consent form and you're happy, the test can then be done.
So I'm going to talk you a little bit and show you how we actually do the testing. So the testing is sometimes done in your room, in the postnatal ward. Sometimes the baby is taken into a quieter environment if you've perhaps got visitors and things around, because it does need to be nice and quiet. Now, Karen's just going to move the camera down a little bit so you can see our baby here. Yep, that's good. So baby needs to be, as Karen said, sleeping and nicely swaddled like we've got here, because any sort of movement of the arms coming up towards the face or towards any of the equipment will cause interference and could affect the results of the test. So obviously, once your baby is nice and asleep, we then need to put on the equipment that is required for the test. So the first thing that we need are some ear couplers. So that is what's in this packet here. And the second thing that we need are some electrodes. So inside of here, there are 3 little electrodes, and I'm going to show you where we put those on. Now, there is obviously the screening equipment itself, which I don't have here today, but I'm going to talk you as far as putting all of the equipment on prior to the test. So the first thing we do is open up our electrodes. And we have 3 little electrodes here. Now, one of these goes, there'll be a wire that comes on the end of each of these 3 little stickers. One needs to go onto the base of the neck, and this one, I don't know about you, Karen, but I find this
is tricky.
The trickiest one to do without waking the baby. So it just involves you slightly lifting the baby and popping it on the nape of the neck. Again, it's a bit difficult if there's a lot of hair there, so we just try and move that out the way a little bit. So we pop baby back down. And then we will pop the second electrode on the side of the face, like this. And just to mention, these are not really sticky. They're more like a gel, so it doesn't hurt or pull at your baby's skin at all, which is why it's quite safe to use. And then this third and final electrode goes onto the top of the head here. And again, as I said, there'll be little wires connected to those. The next thing we'll do is open up our ear couplers. Take them out of the packet, and that's what they look like. Again, they're like a gel as opposed to a sticky sort of pulling material. Now also there'll be a little wire that connects into both of these. There's a red wire and there's a blue wire, and those will indicate which one goes on the right ear and which one goes on the left ear. So we just peel these off. And with the electrode facing up to the top, we will actually cover the whole of your baby's ear with this sticky couplet. We'll then pop on the second one onto the opposite ear. Again, trying to do this and keep the baby asleep can be tricky, can't it? So once everything's on, again, we're making sure that the baby's nice and still, and unfortunately they can't have a pacifier or a dummy in while we're doing this, because the sucking actually affects the test. So once we've got the baby all set up with the equipment on and is nice and asleep, we will press start on the machine. And sometimes if the baby's nice and settled, it can be as quick as 20 seconds that we will get a result. If there's a little bit of movement that we have to pause for, sometimes it can take up to a minute or 2. Now, what the test actually is looking for, it will pass a very sort of low sound into the baby's ears, and it's a reflex that we're looking from inside of the ear to give us a result. We can get either 2 ticks on our screen, 2 green ticks, which indicates that both ears have passed the test. We can get a green tick and a red cross, which means one of the ears has passed the test and one of the ears has referred. Or the other result that we can get is 2 red crosses, which means both of the ears at that time have referred. Now, if this is your baby's first attempt at this test, we will repeat the test within 12 to 24 hours if we have had a refer on either side, or obviously on both sides. And we will repeat that again when baby is settled in that 12 to 24-hour period. If at that point we still get a refer on the second go, then your baby will be offered an audiology appointment once you go home. So that is as far as the test goes. It's very quick, painless, and easy. And yeah, so the results are immediate for you before you go home. So I hope you found this useful. If you've enjoyed this video, then please like and subscribe to our channel so that you can see any further videos and you can help our channel to grow. Thank you.